Hello, folks. Welcome to another edition of Inside the Marble Palace, Postmedia's report on goings-on at the Saskatchewan legislature. I am Murray Mandrick, political columnist for Leader Post. Joining me this week, Lynn Giesbrick, who you'll know from the COVID calls, from her stories, because she's done a lot of them over the last little while. You're getting pretty good at this.
Well, it's become a little old hat after all this time. So.
We're an old hat. Well, it's about all that's old about you, but that's a good thing. And my partner in crime on CBC Ledge Chat and other things, Adam Hunter, political affairs reporter for CBC Saskatchewan. Hi, Adam. How you doing?
Hi, Murray. Hi, Lynn.
I guess we'll start with you real quick, Lynn. This week's COVID update with Health Minister Paul Merriman had maybe a few surprises, although I think we somewhat anticipated this. The notion that we would now have a situation where there would be less vaccine uptake than the government hoped for probably is a little bit more surprising to government than it is us. But tell us what you've seen or what you've looked at and what you were told related to the number of people being vaccinated and the problems that might be at hand in relation to that, Lynn.
Yeah, so I think it's worth setting this up by saying over the last week and a half, we've been seeing way more second doses every day than first doses. So, I mean, that's good. We want more people to be fully vaccinated, obviously, but that means the number of new people getting vaccines is pretty small. It took us 4 days to go from 67% to 68% of adults vaccinated. So that's slowed significantly. But yesterday, the health minister, Paul Merriman, said, it's not vaccine hesitancy, it's complacency. People are like, I'll just get it later. I'll wait a little bit. It's nice outside. But I think other people are saying we're definitely hitting some vaccine hesitancy barriers. Like we're starting to see those harder to reach groups. Who are maybe not as eager to come out for their first dose. And especially now that all of those eager beavers who got their first one a long time ago are rolling around a second time to get their second dose, it's probably getting even harder for those who were maybe less eager the first time around to even get in for their first dose.
Tell us about the second doses for a moment, Lynn, because the majority of vaccinations that are happening right now happen to be those second doses, people that are in the older category. I think we're 60 and up now that can get their second dose quite clearly. Is it a problem in relation to them gobbling up all the vaccines, or is it just more of a situation of availability and them taking advantage of it? I know a bit of it is the AstraZeneca issue.
Yeah, that's something we haven't really gotten a clear response on from government, I would say. They said we knew this was going to happen, that there'd be this overlap between the start of second doses and the finishing up of first doses. But with the heavy emphasis on second doses lately, it's not really clear if that just means people want their first doses still and can't get in, or whether people just don't want their first doses anymore. We've kind of run out of that group of people. But AstraZeneca, for sure, that was what was going through the drive-through clinics in Regina and Saskatoon over the last couple of days. Starting today, it's back to Pfizer in Regina. But the last day of that in Regina and Saskatoon, we saw virtually no lineups. And yeah, I know Dr. Shahab said, Scott Livingstone said that, they had been giving quite a few out the couple of days before of AstraZeneca, but that last day, the demand wasn't really there. So they're kind of evaluating what's happening with that.
And Adam, I know I went through for my second dose because, as you remind me, almost on a daily basis, I am old, and it's hard to deny. But I noticed that the day I went, it was basically a 15, 20-minute lineup, maybe almost as long as the wait after. So it's gone down significantly in terms of that. And I don't think, judging by just watching people go through, I saw many first dosers going through. You've done a lot of work on this particular area as to who is getting their doses, both in terms of demographics and in region. What are you seeing right now? And I guess maybe one of the interesting things is, wasn't the Premier asked and maybe even warned about this a couple of weeks ago, about the hesitancy of younger generations that were slowing down? He said it wasn't a problem, but as Lynn outlined, it seems to be a bit of a problem right now.
Yeah, if you're looking at under 50 and under, really, it is slowed considerably, as Lynn pointed out, just a few percentage points per day. And Saskatchewan was at the back of the pack, almost last in second doses among the provinces, is now vaulted to second, almost first, behind Alberta in just a few days, going from like 4% to 12%. So you can see the huge jump in second doses. And yesterday, Paul Merriman talked about that when he talked about how, they're focusing on second doses. They want to get the more vulnerable population fully vaccinated, but it's always been about first doses. Saskatchewan's reopen plan isn't tied to second doses. It's tied to first doses. It's about getting 70% of those over 18 to get to step 3, and then fully through step 3, 70% of 12 and overs. And there's been a significant, I would suggest, slowdown in those aged 30 to 50. And why I think that's significant is when you look at Saskatchewan's population, we have the highest percent among provinces of kids, those under the age of 12, who won't be vaccinated in the next little while. And typically their parents are 25 to 40. So we're seeing those kids who can't be vaccinated or protected, and a lot of their parents right now, it looks like, are choosing not to be vaccinated with the first dose. So nearly 100,000, 80,000-ish in that 30 to 40 range who still need to get their first dose, and similar numbers in 40 to 50. And Paul Merriman suggested, on that call, that he doesn't think it's hesitancy. He thinks it may be complacency and people that have other things to do, as Lynn pointed out. But maybe it's also, a lack of the government incentivizing, that people think that now that things can open up, someone else can do the work, go get the shot, we'll get to 70%, no problem. And I think the government may be reluctant to do an incentive because it may be an admission of, well, our plan isn't working the way we thought it would. We're going to have to offer something to some people now, offer a carrot. We see in Manitoba, they're going to give a vaccination card that's going to have a code and a name on it, no other real identifying factors that are going to be able to give you certain perks, let's say, not having to self-isolate after you're a close contact, and some other things that they're expected to announce, that they say they'll announce over the next few weeks. And Manitoba, obviously, as you know, Marie and Lynn, has a higher COVID issue right now with people in hospital and cases. And so maybe they're more inclined to get people a little push they may need to get those numbers. But we can't get second doses. We can't get a high number of people fully protected if we don't get more first doses, specifically in people who are working, who have kids in that 30 to 50 age group. And that's something that I think we're going to have to watch over the next few weeks to see what the government does do to incentivize them to get that first shot and eventually a second shot.
Let's expand on that for a minute. I'll get back to you on the whole vaccine question and the outcome of people not getting vaccinated in a moment, Lynn. But you touch on a good thing that I still am struggling to put in proper perspective that myself, and that's really how much the government deserves to wear this and how much of the situation is just generally the difficulty of moving a population to doing something in coordination that we all have to do if it's going to be successful. Now, you spoke about how the government hasn't offered many incentives, and it's probably has a point that there's only so much it can do to incentivize people to go out and do things. That said, I was intrigued by your point that they seem to be sticking to their own narrative, their own language about how they should handle this and how they can't do this or they can't do something else in order to make COVID work. The question I have is, how much does the government have to wear this in terms of that final push? We see the opposition saying, okay, well, maybe $25,000 will incentivize people. I'm not so sure that's necessarily the case, but what is the government's reaction to the notion of incentives, and where do you think they could have applied more subtle pressure other than stickers to say stick it to COVID and other things that are going to get the enthusiastic people there, but maybe not others? I guess where did they go wrong, and what could they possibly have done better, as per maybe the opposition's suggestion that I'm most curious about?
Yeah, I think it's been raised by a few people, but it would be interesting to see, and I know Lynn would probably welcome this information as well, seeing where there's vaccine hesitancy, seeing where there's low uptake by age in Saskatchewan. We know where people are more vaccinated than others. We don't know how that breaks down by age in other parts of the province. Dr. Shahab mentioned in the north, there's more younger people, so that may have an impact. You have certain pockets of communities where there's going to be younger, older. I'd like to see how that breaks down. And I think the other thing that we have to kind of watch on this, as a few weeks ago, the government decided we're going to put this out to pharmacies. So we're not going to have a centralized booking system. You're going to have to call around to different pharmacies to find out if they have the vaccine you're eligible for, when they have an appointment, and we can judge driving by the drive-through or going through the drive-through like you did, Murray, on how busy it is, the faces we see there, but we don't have a sense of how this is rolling out in pharmacies. Are people running into roadblocks? Is it readily available? How quick can you get an appointment? And when you put barriers in place to people, even though you're offering at more places, it may be less convenient. So Dr. Shahab talked about increasing convenience. So if there's evidence that the government has actually created more barriers by going to pharmacies and splitting the vaccine 50-50 with pharmacies, and it's become harder for people to get an appointment, then that's going to be something that's not hesitancy. It's going to be just people aren't able to get it. And I think we'll have to see how that plays out as well. But that's something that's in the government's control. Not creating a centralized booking system for pharmacies is in their control. They decided not to do that. And if people are finding frustrations with being able to book their vaccine because of that, then that's going to prevent people from going to get the vaccine.
I want to expand on your thoughts on this at one moment, but before I lose the issue, because I think it's such a bloody important one. The story that you did this week, Lynn, about who is getting sick from COVID right now, I found simply fascinating. And in many ways, it was one of those stories that it gets done in journalism that's a big favorite of government, even though they might not acknowledge that. But it was a big favorite of government. It was actual good journalism in the sense that you talked about the number of people who are getting sick who aren't vaccinated. Can you offer us the number and who these people are? And in many ways, I think it serves the government's point. This is why you need to get vaccinated, folks, because if you're not getting vaccinated, you're getting sick.
Yeah, I thought it was a very stark reminder. Dr. Shahab at Tuesday's news conference presented the numbers. And so for all of May's COVID-19 cases, all of the reported cases in that month, almost 92% of them were people who had either just not gotten a vaccine or hadn't gotten it or hadn't yet passed the 3-week mark after getting their first dose. So that's a huge number, and only 8% were those like breakthrough cases where, after 3 weeks of your first dose, you're still getting COVID somehow. And then the vast majority of hospitalizations were people who had not been vaccinated or hadn't yet hit that 3-week mark after the first dose. And a lot of those were older people. So most hospitalizations were people over the age of 60. And it's like, well, okay, they've had a chance to go and get their first dose for a long time already. So the chances are that a lot of those people have just chosen not to get vaccinated at this point.
A two-part question, though. And the first one is, do we have any sense in terms of those people not getting vaccinated who are getting sick, what their demographics are? Are they younger people? Are they more rural people? Is this northern people? Or what? I assume we know very little, but if you could share whatever you do know with that would be, I think, helpful to the conversation. And secondly, I guess people are wondering, why is it that older people or anybody that has been vaccinated might be getting sick? So the first part, do we know who these people are in terms of the people that are not vaccinated and getting sick, Lynn?
That we don't. We have no age data on those that I'm aware of, at least, which is difficult. We do know that majority of hospitalizations have been older people, according to Dr. Shahab on Tuesday. So, but yeah, there's a lot of people who get COVID and don't end up in hospitals. So we don't have age data on that. As for why people can get COVID after getting vaccinated, that's a bit of a nuanced thing, but some people act once they get their first doses in like 30 seconds later, they're good to go and they're protected. And that's not true. It does take vaccines time to protect you. And so there's that 3-week window where it takes the vaccine time to really build up your immunity. And so that's why, basically, according to the health data, they don't really count you as vaccinated until 3 weeks after you've had your first shot. And then it's the same thing with the second dose. They actually give a 2-week window then after the second dose to be considered fully vaccinated with the full immunity it can give you.
Adam, getting back to the issue of how this plays into the Premier's strategy, the Saskatchewan Party government's strategy related to reopening. I guess I'm curious about two things. What I get asked mostly about is whether there was too violent a push to hit those reopening targets of 70%, various age groups. We've obviously hit the 30 plus category, the 40 plus category in our opening, and we are on our way to hit the 12 or the 18 and up and 12 and up category for full reopening. However, two things that are of interest to me with this recent hesitancy. Is there any fear that we might not even hit those government targets? And I guess the second part of the question would be, having hit those those targets right now, are we now sort of seeing a narrative as to why those targets might be a little too low if we are seeing a situation where a large volume of people in specific demographics or specific areas aren't being vaccinated?
I think the government is going to keep a close eye on where those numbers are headed. And as we've talked about, they've slowed down and they are going to hit the target, but are they going to go much further above that? And we know the Premier and the government loves boasting about how Saskatchewan leads in X, Y, and Z. And early on, it was leading in first doses. It was leading in percentage of first doses out per capita. And since we've moved back to the pack, we haven't heard that. And if Saskatchewan gets to a point where we are among the lowest as far as the population covered with vaccine, there are going to be some tough questions for the government as to why that happened. And I think the questions from the news conference that came out are, what are you going to do to get people more excited or out to get a vaccine? And something we haven't touched on is, how are you getting to populations that are maybe tough to get to? And that could be for a number of reasons. The health minister talked about newcomer populations, putting things in certain languages to make sure they have all the information, getting all the science out there. Dr. Shahab says, talk to your doctor. Well, not everyone has a personal doctor they can call up or get an appointment with to ask vaccine questions. And I think the slides we talked about, the information that was shared, that Lynn was reporting on and that other outlets have reported on, about the 92% of cases for people that are vaccinated, are unvaccinated, that could probably be the government's number one go-to when it comes out with its social media posts and talking points. And I think that for a long time it's been, get vaccinated, it's going to protect you, it's going to protect other people. But now that we have this real world data that's showing how it's affecting people, that's really powerful. And I don't know if that's been used, even weaponized enough to get people out there to go, hey, this is going to help you, it's going to help someone else. And even if you think you're okay, you could be hospitalized and your symptoms, or you're not going to get as sick. And I think that's something that we've heard from time to time. It is mentioned, but it's not sort of being hit over the head in front of people. And I think, yes, the numbers that were shared in the news conference, they just really stood out to me. And I think they're going to stand out to a lot of people, but it's getting that message out that's really important.
Next week, we're going to see, I guess, a further push in terms of second doses. I guess one thing that we'll have to cover this off, I guess, reasonably quickly. We have enough vaccines now. We shouldn't have any problem moving forward in terms of being able to do to meet our goals. Are we going to hit the targets for, I guess, the June 20th is the next big date, Lynn, by what you're seeing right now?
I don't think there's any question that we'll hit the 70% of 18 and up by June 20th. I think we've got plenty of time to hit that. A smaller question remains in my mind about whether we'll hit the 70% in 12 and up, but I think even that is still pretty likely, especially with the vaccine rollout happening in schools, still continuing over the next little bit here. So I think we will hit those targets, but like Adam said, I don't know the likelihood of us reaching much above those 70% benchmarks.
And Adam, I don't want to leave until you touch on this point one more time. You mentioned it earlier. We have the highest percentage, or one of the highest percentages in the country of kids under 12 years old. People don't realize that. What is the impact of having so many younger children who aren't eligible for any kind of COVID vaccine right now?
It's going to skew the numbers. So when we look at percentage total population vaccinated, Saskatchewan will always sort of come in under unless we're going over and above and vaccinating more adults. So when people see the charts that are shared, that a lot of people are doing good work on this in media and outside of media, they're going to see, oh, Saskatchewan's really lagging behind. It's going to be pointed out that the prairie provinces, really Saskatchewan, Alberta, and Manitoba, have very similar demographics when it comes to kids under 11. And as I mentioned, that means lots of parents and the importance of the parents getting vaccinated. And this is going to go back into school. And we haven't talked about, a fourth wave or the fall or variants really at all, but there's going to be a push, I think, in the next few weeks, what we've seen in Britain and other places where this Delta variant, a more contagious variant, and there's more concern about vaccines with that variant as well, that if there is going to be, a surge in cases at some point, that it's going to pop up in populations that haven't been vaccinated or under vaccinated. So very soon we're going to be able to see in real time when we see a case in a community or communities that is an under vaccinated population based on the numbers we've talked about. When you see that 90%, that is going to be translated into smaller populations around Saskatchewan. If you've been tracking the numbers for a while, Southeast, Southwest Saskatchewan, North Central Saskatchewan are the most under-vaccinated right now in the province. Saskatoon and Regina are leading the way by far. Now, Saskatoon and Regina have had more drive-throughs, obviously higher population, but they are leading also in percentages. So there's more people willing to get a vaccine in Regina and Saskatoon. And the far north is dropping behind considerably, and they've had access to the vaccine much longer and at lower age ranges. And so how the province meets that lack of demand, let's say, in the far north and in the pockets of the southeast, southwest, and north central, and any other areas. And Dr. Shahab said they're going to have to be watching this. And I anticipate that we're going to see when we hear about, well, there's a pop-up clinic here, or we're putting mobile clinics in some of these areas, we're going to know that those are under-vaccinated areas, and the government's really focusing on that. And that's going to be something to watch. So watch where there's outbreaks, watch where there's a cluster of cases, and watch where the government is really focusing its efforts to get those mobile or pop-up tests or lots of drive-throughs and walk-ins in those areas, because that'll tell us the story of where some of these percentages are maybe dropping back because we don't have people getting the vaccine as eagerly as they are in other places like the cities, like Regina and Saskatoon. So that's something to keep an eye on over the next couple of weeks.
Some great information today. I'm sorry, we wish we'd go on longer because I think you guys did a wonderful job of sort of detailing some of the things that people don't hear at the press conferences. But unfortunately, that's all the time we have for this week. Thank you so much, Lynn. Thank you so much, Adam. Muchly appreciated. And we'll see you guys sometime back on Inside the Marble Palace.
Thank you.
Thank you.